My name is Gassia Mikaelian, and I'm coming to you through KTVU Fox 2 News, serving the San Francisco Bay Area. Today, we're talking about the pandemic's effect on people who are homeless, and we are welcoming a longtime advocate for people who are homeless in the Bay Area, Jennifer Friedenbach. You're the head of the Coalition on Homelessness in San Francisco. Thanks for being with us.
Hi, thanks for having me.
One year after this was declared a pandemic, tell me about the biggest impact COVID has had on people who are homeless in San Francisco.
Yeah, I mean, it's certainly been a roller coaster ride, and I think one that is very non-binary. I mean, it's been a disaster for folks who were stuck on the streets, not having access to water, electricity, not being able to shelter in place. At the same time, we had this kind of historic move of about 2,500 people from the streets into hotels. And that was certainly a huge respite for those folks. And our shelters had to close, the libraries closed down, the drop-ins, the cafes, all the places that people usually rely on that are living unhoused were suddenly gone. And so I think there was we saw a lot of people in tents. The city stopped moving and sweeping tents for a period of time so that people could shelter in place. But what we kept hearing from people is they felt like the city had left them out there to die. And we saw that. We saw a huge increase in the first 3 months. We saw about a tripling in the number of people who died outside compared to, a year earlier. And then, but then we've got this, this flip side where tremendous opportunity in the real estate market now where, we're seeing for rent signs around. We're seeing a lot of hope to be able to move people off the streets, being able to buy student hotels, being able to buy tourist hotels, turn those into studio apartments, being able to have subsidies in the private market. I mean, these are all new opportunities. So it really feels very, like these two extremes that a lot of hope and a lot of despair all at once.
Are you hopeful for lasting positive change for people who are homeless coming out of the pandemic?
I absolutely am. I mean, I think this is a magical moment. I hope as a city collectively we don't blow it, but we have a lot of opportunity. We have Prop C, which our organization fought for and put on the ballot and won. And then we won the lawsuit. So that money's released. We have money coming from the state and from the feds. We have reimbursements for some of the costs that the city incurred that previously they thought they were going to have to pay for, which loosens up some funds to do even more. So we have the money. And then we also have the opportunity. And so instead of, like if we take a tourist hotel, for example, we can buy those hotel rooms, turn them into studios for about half the cost of new construction, and they can be available almost immediately. We can do subsidies in the private market, whereas before, we would basically have to send people out of town to be able to even find an apartment for people to rent to that, because the landlords have all these opportunities to rent to people with very high incomes. And now they're willing, they're a lot more willing to rent to poor folks, Black and brown folks. And so so just this opportunity from both sides, both opportunity money-wise and opportunity real estate-wise. And so I'm really hopeful.
Let's talk about something that San Francisco was seeing a lot of in the years really before the pandemic, the recent years, tent encampments. I know many large cities, people living in urban centers know about tent encampments. The city of San Francisco essentially said that's not safe and they broke them up. I mean, I'll be honest, San Francisco is about 20 minutes from where I live. I haven't been to the city in a year. What's the status of tent encampments for people who are homeless in San Francisco?
Well, I mean, all up and down the West Coast, we've seen over the last, several years, rises in rents. And with the rises in rents, we've seen rises in people who are living on the streets. Many folks, not all folks, but many folks, of course, are living in tents because they're very cheap and they're easy to purchase. And it provides a little modicum of shelter. The city's approach, like most municipalities, has been to break up the larger encampments, which typically breaks up communities and support systems and causes quite a bit of displacement for the people living in them if they're not offered an alternative. And it's actually illegal for municipalities to do that. They're supposed to offer a real alternative before they do that. Um, that that law has not been followed, all the time. Sometimes it has been. Um, when the pandemic hit, the CDC put out guidelines saying don't break up tent encampments right now because people need to shelter in place. Because of course, unhoused people are people that are among us, and they go to grocery stores and they,
Right.
all these different things. And if you're outside all the time and you're not able to shelter in place, then that puts the individual at risk and it puts everyone at risk. And so the idea was to leave the tent encampments. The city did for a while, then they started breaking them up again. Um, the Department of Public Health also issued guidelines to not break up the encampments. It's really difficult for contact tracing. If there's an outbreak in an encampment and you break up the encampment, it's impossible to then do the contact tracing. So really made sense for people to kind of hunker down and stay put. But that is not currently the case. I mean, there was a massive sweep that occurred a couple of weeks ago in one of the larger encampments. People were not all offered places to go. There was a lot of just displacement into other neighborhoods, which is what happens when you don't have alternatives for folks. So
Yeah.
that's that's kind of where we're at right now. And we'll see how it goes going forward. I mean, ideally, we're moving people off of the streets, whether they have a tent or not. I mean, there's a lot of people who are suffering that don't have tents, that are in worse shape than people in tents. But the tendency in San Francisco is to only focus on offering services to people in tents, because the tents are what generate the complaints. And so we end up with this very inequitable complaint system that really isn't that fair for people on the streets.
Right. And so many people, as you certainly know, they're homeless, but they are couch surfing. They're homeless, but they're living in their car. They're homeless. It's homeless doesn't only mean those people that we see actually sleeping on the sidewalk. Let's talk about another major concern, and that was getting people who are homeless vaccinated against COVID. Largely, these are people who do not have access. The advice that you and I are able to follow: wash your hands, wear a mask, stay 6 feet. People who are homeless don't have essentially the luxury of doing those things. So how would you grade the city's effort to get people who are homeless vaccinated against COVID?
I think the city's been really trying hard to get creative and figure out how to vaccine. The problem is that they haven't met the state guidelines until last Friday. So
they meaning people who are homeless,
just homeless in general.
Okay.
And so it created a lot of logistical issues for the city. So if it's only the people who are meeting the state criteria, but who happen to be unhoused, it's really difficult to get those folks vaccines. They don't have electricity, cell phones, they don't have ways to make appointments. The large vaccination sites, of course, they're not going to have lineups and drop-ins because, you're infecting people as you're doing that. So it's really difficult from a logistical perspective. So the city's position has been, which I think is right, is that all homeless people should qualify, and that way we can do it in mass. We can go to places where there's large numbers of unhoused people, regardless of whether they meet the other criteria, because they're homeless. We can go through the whole bit and then come back and make sure that they get the second vaccine if it's not a J&J. So I think that's, that was right. But luckily, on Friday, the state approved that. And so now we kind of got a green light, and they'll be able to do mobile. They'll be able to go into the large shelters, go into, but one thing I do want to mention, most of the outbreaks have happened in single room occupancy hotels or residential hotels, which have continued to be hit the hardest. Remember, for your audience, those are places where people are sharing bathrooms, they're sharing living spaces, sometimes they have shared kitchens. They're in essence congregate living, but each individual or family has their own room. And that's where we've seen large numbers of outbreaks. And those are mostly working class people in San Francisco, really poor ventilation, and really, it's been really difficult. So they've been hit really hard. We've also had a couple big outbreaks in our shelters. And that was some of the thinking early on to close those down. So it's, it's been really up and down. And so, thank goodness we're now at the phase of being able to get folks vaccinated. And so hopefully we'll be able to get as many people as possible that are unhoused, that don't have the same access that the rest of us do to making appointments.
Are there plans right now to have a vaccine mobile, that you would, we're in the West San Francisco on Tuesday. On Friday, we'll be in the Union Square area. I mean, how do you get vaccine to people who don't have smartphones to scan the QR code and wait in line at CVS. I mean, how is there a concrete plan for that?
Yeah, they've been wanting to do that, waiting for the state approval. And so there is, you know, we have different mobile medical teams already, and they're building on those, and then going into the sites where people are. And so I think those are the two plans.
Can I ask you to reflect on the impact overall of the pandemic on people who are homeless in San Francisco? It sounds like you've detailed maybe a couple small positives. Obviously, there's been a lot of negative. Looking back over the past year, what are your thoughts?
Yeah, I think, you know, it's really, you know, it's two stories. I mean, for the 2,500 people who were lucky enough to get into a hotel room, you know, where they could have a bathroom, they could have water to wash, they could have access to a shower, a bed. That really has been a hugely different experience than the folks they have electricity to plug in. All of that. That's been a vastly different experience from the, you know, the thousands and thousands of people more that were stuck out on the streets. And so probably more than 4,000 on any one night. We didn't do a homeless count this year, so we don't know for sure, but I think it's at least that number. And so we've, you know, for those folks, it's been really, really tough because of just all the things that that people need to do. I mean, you know, you think about not having electricity and what that means in terms of not being able to charge a device. Whether it's signing up for getting testing, whether it's addressing, you know, trying to get housing, the food situation changed dramatically. You know, there was just, you know, these huge differences, and really trying to shelter in place and thinking about that from an unhoused person's perspective, what the rest of us are doing. You know, we're cooking at home, we're, you know, doing all these things at home, and you're not able to do that. It also means that you're also losing contact with your community. So, you know, a lot of folks will stay part of the month that, you know, maybe they have an auntie that they'll, you know, sleep over every once in a while, be able to get some respite from the streets, use the shower. A lot of people's relatives are in public housing, so they can't do it all the time, but, you know, they can kind of come in and out, or they're in apartments where, you know, where there's a strictness about this stuff. And so, you know, but, you know, they don't want to expose their elderly grandma. So, you know, I mean, all of this means that the whole fabric that people depend on to get through a really difficult hardship, probably the worst moments in their lives that they're experiencing being homeless, made that much more worse because of that disconnect. So I think the levels of despair have been really high. Level of trauma is really increasing, mental health deteriorating, drug use increasing, all of that stuff. It's been a very, very tough, you know, a tough year for all of us, but a very acutely tough year for folks that don't have a safe and decent place to call home.
No, I think about how people with every available benefit are struggling, right? People with a steady paycheck, people who get to live with, you know, people they love, people who have food in the fridge and a car outside that works with gas in the tank. And I think, you know, if they're struggling, which many of us are, think about people who don't have, you know, 6 of the 7 things I just named. You know, it's interesting. Here in the Bay Area, we have long talked about the issue of homelessness. And I recently heard a leader say, you know, they were asked to say one word to people who used to, you know, walk the streets of San Francisco and see people, you know, living under a cardboard box or sleeping in a doorway. You know, if we could talk to that person who has been disdainful or disgusted by, what would you say to help that person really understand the magnitude? And the leader said, I have one word, and that is compassion. It's not donate money. It's not, you know, consider yourself lucky because you have. It was just that single word, compassion. And I thought that was so effective, because hopefully, especially now after the year we have all been through, compassion will not be in such short supply. So that having been said, I ask you, is there anything you would like to say to someone who might not be thinking of the plight of others who have far less than they do?
Yeah, I mean, I think if we think about lessons learned, you know, from this pandemic, and there's so many, for all of us, I think individually, you know, just walking through this world with this weird thing going on, this pandemic, but, you know, if nothing else reminds us how interconnected we are. I mean, we are seriously interconnected, and we think about the health of, you know, of all of our community being so important to the entire community. And, you know, it's really dramatic. I mean, we share the same air, we move in the same spaces, and we're all connected. And I think that's, you know, um, I think that sense of connectivity really galvanized in a lot of ways the city leadership to move very quickly on trying to address the needs of unhoused people and making them a priority, in terms of, you know, just how much their health impacts the rest of the cities. It impacts the number of ICU beds we have, if they're available. And, you know, while this is a heightened, you know, consciousness about this, this is the reality all the time, even outside of a pandemic. And we are really connected. And I think that's, you know, that's for me, regardless of, you know, how people feel and where they're coming from, solutions, to this crisis, really, you know, it helps all of us as a city come together, especially unhoused people, but all of us as a city. And we you know, we have an opportunity now. So I'm hoping that, we are really seriously able to move the dial on homelessness coming out of this pandemic.
Well, as always, you've given us a lot to think about. Jennifer Friedbach, it's a joy to be able to reconnect with you. I know we've known each other for many, many years. Jennifer Friedbach, head of the Coalition on Homelessness in San Francisco. Thank you for your time.
Thank you so much for having me.